February. And in the House, it is Dr. Dan Edney, State Health Officer of Mississippi Department of Human Service Department of Health. There we go. Good morning,
please
sir.
get that right.
I would want you to leave here and go park in a different parking lot. So, how are you?
I'm well. Good morning.
Man, it's been a while. You've got so many things going on. You need to be a regular at least every couple of months here, because I don't even know where to start. First thing is, I need your help on this one, because I had asked a couple of people, and if you don't use and one of the topics of this is to get clarity on the health centers across the state. And I know you heard one of our conversations prior to this, and we needed some clarity to this subject. And let me ask the same question I think a lot of people who will ask this. Where are they? Who are they for? Are they being manned? Do we have enough support there? What can these turn into be? Are they a solution to our health care of indigents in the state? And is the solution possible if we leave politics out of it? So there you go. I can go get a cup of coffee now. Let you handle that one.
Well, sure. That's an easy one. Well, I reached out to you because I listen to you regularly, and you got on a kick of asking everybody about the county health departments and their role in it. And I finally said, okay, you're asking everybody but the health department.
That's true.
Let us weigh in and let you know exactly what's going on. First of all, the health department goes back to 1877 in our state's history. So the state of Mississippi has been involved in public health since those early years, and has been involved in providing for the health of Mississippians since 1877. And since that day to now, we have slowly been expanding our work until probably about 20 years ago, and had expanded to where we were up to 86 county health departments. Now, we only have 82 counties, but we have 2 counties that are too small for a health department, and then we have a few counties with multiple, like DeSoto actually has 3 county health departments, and that's because DeSoto County values public health and invests in public health. Mm-hmm. It's important to know that your county health department building is a county building. It's not a state building. It's not a health department building. By statute, every county that has a health department has to provide that building. They are not required to maintain it, nor are they required to fund it, and they're not required to fund the health department in their county. Many counties do. Many counties, like Bolivar County, for example, up in your neck of the woods in Cleveland, invest heavily in public health. There are some counties that invest nothing in public health. There are some counties that make it known that they're not interested in having a health department. There are some counties that want a robust health department, and we have everything in between. So providing for the public health needs of Mississippians in the 21st century is a challenge. We are underfunded, and that's not just a whining state agency head saying that. It's the reason why we don't do what you and many of your guests have waxed eloquently about from 1955 of what the health departments used to do, is because we don't fund public health like we did prior to 2016. So there's just not enough money to provide county health departments in every county unless counties are helping us with that. I don't have enough nurses to staff 86 county health departments, much less to have enough doctors. There was a bill to put a nurse practitioner in every county health department every week. I don't have enough LPNs and RNs to do that, much less APRNs. 2012, we had 9 public health physicians located around the state. After our budget cuts in 2016 and 17, where our appropriation was cut by 50%, we had to scale back and reduce the workforce, and went from 9 physicians to 3 regional, and had to cut way back on staff. And that's where the closure of health departments during many days of the week occurred. I've been committed to try to stand some of those health departments that are only open 1 to 2 days a week, to get them back open more frequently. If we can get the funding, I've asked the legislature to help us fund 100 nursing positions, and of course everybody needs a nurse these days. I have asked counties to help us provide for public health in their areas, and then we're doing our part and being much better stewards of our resources and raising as much revenue internally as we possibly can, which we made a big leap forward under Dr. Dobbs' administration in terms of collection from insurance companies, especially Medicaid, and we have committed to push even further to try to increase our clinical revenues to fund public health in our state.
Were there any bills to help aid that? In other words, a bill, if let's just say the medical marijuana industry does take off, to maybe take some of that revenue and put it into health services there? Are there any bills at all that were addressed this year? And we understand the appropriation deadline was yesterday. But anything to help the health departments?
Yes. One thing is we have one bill that's doing very well to require insurance companies to recognize the fact that we are healthcare providers in the state and require them, if they're licensed in the state, to contract with us, which most insurance companies do. There's only a few that refuse to. Yeah. But so that the state of Mississippi is not paying for the public health care of people with private insurance. Our appropriation requests are where that money is requested in terms of nursing and personnel.
Is that done in other states, or are we by ourselves on this one? In other words, when somebody comes in, let's just say they did step on, we mentioned this earlier, on a rusty nail, they got a kid stepped on a rusty nail, want to go back and get a technician. None of that is covered by insurance at all, even if they have insurance?
It depends on the insurance company. And,
I got you.
And this bill that is doing well with the legislature is just requiring insurance companies to pay for the care of the beneficiaries when it occurs at the health department.
Give us an idea on, is there a income level where you can go by the health department, or what's the portal of entry as far as using the health department?
The health departments are open to all Mississippians. We are going to ask when you show up if you have insurance, and if you do, then we're going to respectfully file that insurance like anybody would that's seeking medical care. We're going to query the system with Medicaid to see if you're a Medicaid beneficiary, and we will respectfully ask if you have the ability to pay towards your copays, and just have some personal responsibility for those who are able. We will never deny care to anyone for the inability to pay, but there's a difference between an inability to pay and unwillingness to pay.
I got you.
We're kind of getting back to the old days of sliding scale for things like our STD care and and just looking to ask people as they come to seek help of the health department to do what they can to help us provide that care. But we're not going to turn anyone away.
Dr. Dan Edney, who is State Health Officer for Mississippi State Health Department, do they take appointments?
We do. Most of our care is rendered through appointments, but we take walk-ins at every county health department that's open every day.
Give us a little bit of a scope of what they do. Do they have X-ray machines? Do they what's the scope of maybe just giving shots or doing referrals to other doctors, or how far do they go?
Well, we're not a medical home, although we're having to become a medical home of sorts in some counties, depending on access to care issues. But we are the experts in providing HIV, STD care. We are the experts in providing TB care. We are experts in providing family planning services. We're experts in trying to help reduce maternal infant mortality through our Healthy Moms, Healthy Babies program. We provide free, and a lot of people don't know this, that we provide free mammograms for women who are uninsured or underinsured. We provide free pap smears for women who are uninsured or underinsured. We a big initiative that I have in terms of strengthening the safety net is not only strengthening the county health departments themselves, but working with free clinics, working with FQHCs, working with our local critical access hospitals to interweave that safety net even tighter to provide an access point.
So if you do want or need contraceptives on a free basis, the health department's where to go?
It is. Now, again, we're going to see if you have a funding source. But if you don't, we're never going to turn anyone away for the inability to pay.
More on this and some other subjects, too, with Dr. Dan. I'm not going to let him get by this easy. We got other things to do. And, I mean, he wore a red shirt, so he's ready for me. So there you go.
Heart Healthy Awareness Month, Paul.
That's it. More coming up with Dr. Dan Edney. And don't forget, Michael Watson is at 8:05. He's got some things to share with us. The Senate gavel's in. 10 o'clock this morning. House is back at 2 o'clock this afternoon. More next. I had to go and get that in, Doc, because that's the only BMI he'll get on it, or CSAC from the mayor of on his Mardi Gras song before it was too late. So it's done for another year now. So there are other questions here. I was reading this the other day, and I'm just a little bit disillusioned about it because I sometimes take heat from saying I am for the postpartum, but I want to make sure that we're getting the job done and the people are using this, and it's not just thrown out there. Same thing as the health departments, to be honest with you. I mean, the reality is we are giving $80 million to the hospitals. They need that, don't get me wrong, but I mean, it's only a matter of days, and that will be sucked up. What could the health departments across the state do with $80 million?
Ooh, what a wonderful question that is. And I can't control that question, and I can't control what the votes or what votes are given at the Capitol regarding these really important access to care issues. But what I can control is what we can do with the health department. And so as I have watched our maternal mortality statistics worsen through 2019, knowing that 2020, 2021 are going to be even worse because of the COVID years. Our numbers will continue to worsen through those years. That our health departments have to stand up and get back to doing some level of perinatal care for counties that are really struggling with OB deserts, especially in the Mississippi Delta.
Yeah.
But we've had requests in Madison County from populations that are struggling to have access to prenatal care for us to get back to doing it. So we are actively evaluating moving back in time where we'll be, in the counties that need us, we'll be providing perinatal care until we're able to fill those gaps through better ways than for the health department to do it. Paul, when you see the health department doing things such as prenatal care, such as getting back to managing diabetes and hypertension, which is another access issue the health department is going to do to help us through the healthcare struggle, we're going backwards. It means that people are having more difficulty accessing care instead of easier access.
Well, today with the advent of more people to staff those things with nurse practitioners and telemedicine and things such as that, it would seem it's logistically easier to do if we just had the money. The other part of this,
let's talk about that for a second, because we have to do things smarter in 2023 at the health department. And so instead of having 86 county health departments and me sending a nurse practitioner over 2 counties to see 2 patients, we need to be doing telehealth, which is we're ramping that up quickly. And there are areas of the state that just can't support a county health department anymore, but they still need public health access. Yeah. So we are working out transportation services to bring patients to us instead of us spending a lot of money going to them.
I'm curious in what you said a little bit earlier. You said that there are some counties that do not want a county health department, and why would that be? A competition with the hospital?
No, sir. They just don't see the value in it, and they're not willing to put an appropriation for the health department in their county budgets. We have many counties that do a great job. We have some counties that don't do anything. And as we had the conversations with them, we're having to have a bill in the legislature just asking for a minimum standard at the county health departments. And I would challenge you and all your listeners, first of all, do you know where your county health department is? Secondly, when's the last time you drove past it? Thirdly, when's the last time you went inside of it? Some of them you're going to be proud of. Some of them, it's okay, nothing to write home about. Some of them you will be ashamed of, and you would not let anyone in your family go to them, and I'm not going to allow it either. We have county health departments that we have to run possums out in the morning. Yes, that's public health in Mississippi.
How much help are you getting from the people who need this the most? And I say this in they're not coming by, even though the service is there and they need it, at the places that don't have possums. And how do you get to these people? How do you get to the young mother, black, white, or fuchsia? How do you get to them and say, look, you're pregnant now, you've got to take care of yourself? How do you do that? Because, and I say this because Dr. Dobbs, who is now the dean of the School of Population Health at UMMC, gave us some stats, and me, myself, you, not you, but most of us out there who are not attached to the industry of health and medicine, all we can do to help is pay our taxes. Or else, that's all we can do, pay our taxes that fund these things. But he said we're number 2 in the country for syphilis. We're number 1 for all other STDs, essentially, he said. We have documented 3 babies who have died right after being born with a diagnosis of syphilis. Congenital syphilis, a bacterial disease, usually spreads by sexual contact. So when we give our money, what can we do? We're doing it.
Yeah, a couple of things, and that's, to hold those that we elect accountable to do the right thing. That includes boards of supervisors. So have you had a conversation with your supervisor about your health department and making sure that that's in your county's budget to take care of people who have trouble getting health care? Does your county care about it? And then our statewide elected officials to know that public health is important to the people of Mississippi, and everywhere I go, it absolutely is very important.
Is there a test that you can have at the county health clinics?
It is. It's a very simple blood test, and it goes back to taking care of our pregnant moms. It shouldn't take a woman 5 months to get her Medicaid active. We should have presumptive eligibility for pregnant women and doctor's offices. We have it for hospitals. We need it for doctor's offices so that we can do that blood test in the first trimester, find syphilis, treat it easily, and protect the baby from being damaged. Because from my understanding is in this article that there are a lot of mothers who or mothers-to-be that don't know that they have syphilis, and they need to have a check so they can. It's not hard to treat after you know that you have it. That's right. It's very easy to treat, but it has to be screened for. But to do it early, women have to get their Medicaid activated early. So you have much hope that we're going to make much improvements in this session, which the session is for all practical purposes almost over? I have hope in my public health workforce, despite being battered to pieces through COVID. And going back to your question of how do we get the word out, that's on us at the health department. We have come through a pandemic response, but we're past that now, and we'll be employing community health workers in every county to get out into the communities to let people know what we do, let people know we're open for business, let them know we're here to help, and also to find out what that community needs from us and to listen and provide the services that are necessary for us to provide. But if there's some job openings in some of these health clinics around the state, do they contact you, not the county supervisors? Not the county supervisors. We provide all the staffing. We pay all the bills for running the health department. They pay the bills for the building. I would imagine postpartum passes or not, it looks like it's not going to go anywhere. It's effectively dead. The county health departments are a big part of this to take up that slack one way or the other. We have to, and it's frustrating because I don't have a funding source to take up that slack. But we will fulfill our mission, which is to promote and advance the health, safety, and well-being of every Mississippian. Let me do this. The mission of all of us. Yeah, and before we let you go, and the time is going to run out here, this weird fungal infection, is it C. auris? Yeah, Candida auris.
And it showed up at some long-term care facilities. You want to speak to that, and where are we? What's the status of that?
Yeah, it's another reason why you need to thank God for the health department. This is the stuff that we do. We have a whole department that focuses on what we call emerging infections, and this is a brand new one. They seem to pop up, every year or so. And here, this one's very difficult to treat. It's very difficult to kill. I mean, it's even difficult to clean a room to kill it. It's something you don't want. We are working, and it's a national issue. It's not just a Mississippi issue. We're very early in Mississippi, but it's here. We're working with protocols with our long-term care facilities and looking at appropriate isolation protocols and disinfecting protocols as the CDC works more towards appropriate treatment protocols.
It's got a pretty high mortality rate. Is it in elderly people? Is it? You said it's highly contagious. Is it contagious through the air or through infections or wounds or what?
Mainly through hospital environment. It has a high mortality if you're infected by it, but it's usually older, sicker people who actually get infected versus those who are colonized.
Attacking the blood, attacking the lungs?
Blood, and mainly getting into the bloodstream, causing septicemia.
It also appears that the Medicaid is not going to go anywhere for this year. So any other bills out there that are live that you want to mention real quick? And I'll give you the final say when we come back on the final segment here in a moment or two. Final thoughts from Dr. Dan Edney and then Michael Watson after news coming up at 8:05. We are back live in the Trustmark studios, and I thank you so very, very much. It's always good to have good information on our C-Smart text line. Dr. Edney is an excellent boss. He actually goes out into the field and sees his staff and really listens to concerns about what is happening to his staff. So there you go. And I didn't do this my own. Is it true?
It is true. I'm heading to Clarksdale tomorrow, and meet with stakeholders, especially about difficulty with obstetrical care in the Mississippi Delta. And you and I, as Delta boys, need to care about what's going on in the Delta, my friend.
If I was rewriting this and thinking that in my mind what a health department would be every single location would be up to speed and have the most modern things they need.
Right.
I would like for them to be open as many days a week and as late as they possibly could.
Maybe not.
I wouldn't have a problem having that restricted to an income where it was solely for, certainly in the rural areas of the state, where it is a free service for those who need it. Everything from physicals to dietary needs and things such as that. But that's not where WIC is issued now anymore, is it?
It is. We're still the USDA contract provider for WIC. But WIC now, we don't have the WIC centers anymore. That's all done by debit card. And much more. And it's an example of providing services in a much more efficient manner. But we still take care of WIC, as do FQHCs and other partners.
Final thoughts here as we wind it down.
Well, the main reason I wanted to visit with you today was I appreciated your interest in what role the county health departments needed to serve in this very real crisis of access to rural health care in Mississippi. It's worse than I've ever seen it in my professional lifetime. And that we do see our role, and that role is that we are the provider of last resort. We're the last man standing in terms of being able to help people. If we don't catch people, they don't get caught. And so we are going to invest every resource that we have to try to strengthen that safety net and to try to be a help during this time for communities that need us, and just do the best we can to protect and promote the health, safety, and well-being of every Mississippian the best we can.
Have you ever had grasp of a figure, somewhere talking to some of the legislators, certainly the committee chairman, of what we're talking about monetarily, how much it would take on a yearly basis to bring them up to, we do that as far as state parks and things such as that. Is there a figure that is in the ballpark that we need?
This is not what we've asked for, but right now we are the lowest funded Department of Health in the Southeast. The state invests $15.77 per person per year in public health for each Mississippian. The next lowest state above us is Georgia, which is $30 per person per year.
Wow.
And then you get up to Tennessee, which is $65 per person per year. And that all goes back to the severe appropriation cut that happened in 2016 and 17, which we've never recovered from. But we are so grateful for our partnership with our friends at the Capitol, and they've been nothing but supportive this year, knowing what our needs are, knowing what our desires are in terms of serving the people of our state, being a solution, not just somebody griping, but being part of the solution, not part of the problem. And all the conversations about funding have been positive, Paul. We're appreciative.
Well, I understand that, and you're really being nice about this, but I also look at it, the situation, and we talked about this for years and years and years, and prayed to God that we have over 5,000 babies not just terminated in the womb, and after Dobbs, we have that prayer come true now. And what are we going to do? You just going to get off the front pew of church, stop, and your job's done. There are going to be consequences with this. God forbid that there be 5,000 babies unwanted. We're hoping now that the better decisions are made. But we will have an increase in unwed children in the state if you don't have the abortion service. If, in fact, you had 5,000 births and how many abortions we normally had prior to this decision. And I would imagine the health departments are going to be an integral part of this, or can be, in solving the situation.
We can be, and we will to the greatest extent possible for us, and which is why I'm not asking for $1 from anybody without me trying to raise my own. And so we're getting our house in financial order as we do let our needs be known at the Capitol. But public health is worth investing in. And you, Paul, and I both know you invest in what you care about, right?
I agree, and we've already seen numbers that when we don't have to take care of somebody who's got a bad start and all of a sudden they live to 70 years old, but through that period of time are usurping a great deal amount of money from the public taxpayers because of poor health.
Poor health is very expensive to the state.
It's a no-brainer in that particular case. Always a good, active conversation with you, and I thank you. So don't be a stranger.
Thank
Appreciate
you, my
it very
friend.
much.
Thank you so much.
You got it. Dr. Dan Edney, State Health Officer